everyone. For those who are watching live, thank you so much for joining us. Delta Dental is partnering with the Diabetes Foundation to talk today about the connection between oral health and diabetes. So I'm going to turn it over to Danielle from the Diabetes Foundation.
Hi, everyone. I'm Danielle Kennedy, and I'm the lead diabetes educator at the Diabetes Foundation. And it's my pleasure to introduce you to Dr. Keith Libou. Dr. Libou is the Chief Clinical Officer at the Delta Dental of New Jersey. Keith, thank you for being here with us today for National Diabetes Awareness Month. So,
I did.
Yeah, go ahead.
Well, it's great to be here.
Yes, we appreciate you. And we know just generally from educating people and the public that there's a lot of people who are unaware of the impact oral health has on diabetes. So, Dr. Libou, can you share with us how these are connected?
Sure. Danielle, diabetes and oral health can affect each other in very significant ways. People with diabetes can have higher blood sugar, and having high blood sugar can weaken the immune system. And when the immune system is weakened, it makes it harder to fight bacteria in the mouth. And when the body can't, when the body can't fight off the bacteria in the mouth, it contributes to gum infections such as gingivitis and periodontitis, which is frequently referred to as gum disease. Additionally, people with high blood sugar, people with diabetes, typically have delayed wound healing. And this can be very significant in the mouth because there are a number of procedures that are surgical procedures people may have in the mouth, such as gum surgery or extractions. And when somebody has high blood sugar and they're likely to have delayed wound healing, that's a significant concern that the dentist needs to be very, very aware of. Also, people with diabetes can have reduced salivary flow, like a lower level of saliva into their mouth, which leads to dry mouth. And when somebody has dry mouth, it increases the risk of tooth decay and oral infections. Not last for other things, but high sugar levels in saliva could encourage fungal growth. And this could lead to yeast infections in the mouth, such as a thrush infection. Also, chronic inflammation from gum disease can interfere with how the body uses insulin, which can lead to insulin resistance and higher blood sugar levels. And the higher blood sugar levels can then make the gum disease worse. So it's really a cycle where the oral health, the diabetic condition could affect oral health. Then oral health, active gum disease could increase the blood sugar levels. So it really is a cycle, and they're very, very interconnected.
That makes sense. So, there is such an impact, a significant impact on diabetes and blood sugar levels from the dental health perspective. Because dental care is an important part of diabetes management, Dr. Libou, what are some ways people can help manage their diabetes through dental care?
Well, it's very, very important to make sure you're seeing your dentist at least twice a year. Some dental plans may even cover more frequent cleanings for individuals that have diabetes. Danielle, as a dietitian and diabetes educator, could you share some nutritional tips for those who are managing their diabetes?
There are a lot of tools related to nutrition. I would say that, we know that nutrition impacts diabetes, right? So we know when we eat food, our blood sugar goes up. And what we're looking for when we talk about oral health, we want to prevent this spike in blood sugars post-eating, right? So there's a lot of different foods that will help support us. The combination of a balanced diet with macronutrients, including protein, fats, and carbohydrates, will help with the post-meal blood sugar spikes and excursions that we want to avoid. In addition, looking at lower glycemic index foods foods that often are more whole, have a high fiber content. These are going to help with the slowing of digestion and create a more gradual rise in blood sugar as well as insulin levels. So that's really important when we talk about meals and snacking. And these will help stabilize our blood sugars and support our overall health, helping the body to have to work not so hard when there's a phase of insulin resistance that we're going through. Some examples that I want to share with you for the foods when we talk about this is, emphasizing the non-starchy vegetables is really important. So broccoli, cauliflower, peppers on your plate, up to a half a plate if we can. And then the sources of protein, we want to look at leaner sources, less fat, so things like chicken, fish, and turkey. And then, when we emphasize fats, which certainly they need to be a part of our diet, they will help with the post-meal excursions of blood sugars because it takes time to digest fat. And so the healthier sources of fat are going to be things like nuts and seeds. And lastly, I just don't want to forget the importance of hydration. Hydrating at all times, especially with that high fiber diet, water is always going to be best. But also, Dr. Libou, I know that we've talked a little bit in the past about carbonation and other beverages that may be considered, healthy for us, but also have a negative impact on the oral area. So if you can share with us and give us some tips for that and other tips for overall dental and diabetes health, that we would really appreciate that.
Sure. When it comes to carbonated beverages, I think most of us have had that experience where you drink something carbonated and you notice that your teeth feel kind of gritty. Mm-hmm. They feel they have that kind of like sandpapery feel afterwards. Well, the reason for that is these carbonated beverages are acidic and they actually can demineralize the enamel of the teeth. So something that's important is after you drank something and a carbonated beverage and you notice that gritty feeling, you don't want to brush your teeth right away because the saliva in your mouth will help remineralize the enamel. But it's a good idea to rinse with water. So after you get that gritty feeling, you had a soda, carbonated beverage, just use some plain old water, rinse it out. Then about a half hour later, that's a good time to brush your teeth. I also go ahead.
Does that apply to when we enjoy some candy as well? And I know, of course, we don't want to encourage too much candy, but we know with the season we're going to be eating sweets, so it's important for us to think about that as an idea for oral health. What would we do? What's the best practice with brushing, and maybe just what type of candy you would recommend if people are consuming candy?
That's a great question. And in addition to talking about candy, I'm also going to include other things like even gummy vitamins, in this conversation, because candies and gummy vitamins, those kinds of products can also be acidic. So after you've had, whether it's the candy or you've had a gummy vitamin, again, the same guidance as with a carbonated beverage. Rinse out with water, and wait about a half an hour before you brush your teeth. You want to give your teeth the opportunity to remineralize. If you're going to have candy, it's important to think about a kind of candy that is not acidic and that washes off the teeth easily. And when I think of this, I think of chocolate. Plain simple chocolate with no caramel in it is probably one of the friendliest candies for your teeth. After you've had it, you could rinse out and then half an hour later brush your teeth, and that works out really well. Just this past Halloween, I was out trick or treating, and I wasn't really thinking too much, and I grabbed a box of something along the way, and I opened it up, and there was chocolate. Unfortunately, under the chocolate there was a very, very sticky caramel, and I thought this was going to pull the fillings out of my teeth. And that's how strong and sticky this was. So that was a mistake. Normally, I limit it to regular chocolate. So fortunately, I did not lose a filling.
That's good.
Uh, and 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 if I had, it would have been okay because I have Delta Dental insurance. Uh,
Yeah.
so that would have worked out just fine.
Yeah.
So those are some good rules of thumb in terms of having some candy and
Brushing.
gummy vitamins and things like that.
Perfect. That's great. I just have one more thing. What about chewing sugar-free gum? Is that helpful in any way? I know you've mentioned, when I think about dry mouth and I think about diabetes, if that's something someone's experiencing, can sugar-free gum assist them in any way?
It can, it really can, because when you chew sugar-free gum, it stimulates salivary flow. It gets more saliva flowing, which is good for remineralizing the teeth and helping to protect against decay. So in particular, if you're in a situation where you can't brush your teeth right away as well, it works out really well because it'll have something of a cleansing effect also, mechanically, just for the chewing motion. So yeah, sugar-free gum could be good. I'll just caution that moderation. You don't want to do it too often. If you happen to have any TMJ or jaw pain or jaw problems, it might be something you'd want to avoid. And I'd recommend talking to your dentist about that.
Great. I appreciate this conversation. I think one of the things that we don't realize is that we want people to know that dentists are very helpful in understanding more about their diabetes. They can identify things like gum disease early, and you're bringing that to our attention. And I think that's a really important topic to always know about. And I know preventative care is really important as well. So thank you for being here today. Thank you for informing all of our patients and the public about diabetes and the connection with oral health, Dr. Libou. And thank you everybody who tuned in today as well. Dr. Libou shared with us some tips for diabetes and oral health, everyone. So if you can go to www.diabetesfoundation.org to view those tips. Thanks so much. And
Hey, Danielle.
yes.
Do you mind, can we answer one question? We did actually get one question in the chat.
Yeah, sure. Sorry.
Okay. So the question is, does having type 1 or type 2 diabetes impact your oral health any differently?
I would type 1 and type 2 diabetes are very different conditions, but in terms of oral health, I would say that you would approach things the same way. Yeah, that was an excellent question. Hey,
Great.
Danielle, before we wrap up, I just wanted to close out with a few dental tips, if I could.
Oh yeah, that would be.
Well, the first, I just want to reinforce from what somebody could do themselves as a what they could do at home to take care of their teeth. Make sure you're brushing twice a day with a fluoride toothpaste, and don't forget to floss. Flossing is absolutely critical, because if you're just brushing and not flossing, you're missing the in-between parts of the teeth, because there's just no way a toothbrush could adequately get in there. So make sure you're brushing twice a day. Flossing is absolutely critical for good gum health. Use a mouthwash. I'm a big advocate of alcohol-free mouthwashes, but I personally love using mouthwash. And brush your tongue. The tongue can actually have a huge amount of bacteria build up on it that can contribute to bad breath as well. So make sure you're brushing your tongue as well. And if you have difficulty, physical limitations, you just can't handle the floss, there are other things you could do. There are devices you could hold in your hand with a little piece of floss between them. There are water flossers, which have come around over the last number of years, that are excellent for people who cannot handle floss. They can't handle the strength. So water floss, which is an evolution of the old water pick, can be an excellent alternative. Avoid smoking, and if you're going to chew gum, use sugar-free gum, which we've already talked about a lot. Drink plenty of water, limit alcohol, and really, and Daniel, you really went on about it. limit sugary foods. And last, talk to your dentist. If you have diabetes, talk to your dentist and talk to your hygienist, talk to your dental team. They can address any questions or concerns that you have about how your oral health relates to your overall management of your diabetic condition.
Those are all great tips and recommendations. And I just have to follow up with the alcohol-free mouthwash. Is that just to help with dryness, because alcohol can dry out the mouth a little bit?
That's exactly what it is. It dries out the mouth to a greater degree, and that could actually cause kind of a rebound, an overgrowth of bacteria when they repopulate, and they will repopulate. And sometimes when that happens, you're not getting the bacteria that you want coming back. You could get harmful bacteria coming back, and it could contribute to potentially maybe more bad breath afterwards. So again, mouthwash is excellent, but I personally like alcohol-free mouthwash. But talk to your dentist and get their guidance about it.
That's wonderful. Thank you so much for all this information. And again, thank you for being here. And you can view all of the tips and recommendations from Dr. Libou on our website at thediabetesfoundation.org. Thank you, everybody. Have a great one.
Thanks, everyone.